So, hi everyone. Today I have the honor of introducing to you Dr. Sidharth Mishra. He's a dear student, a very popular educator, a very famous teacher. He's been teaching you community medicine for your NEET PG entrance with DAMS for I think more than a decade now. And also, he has taken a plunge into teaching residents on the DAMS app for their community medicine residency. And I'm proud to say it is one of the largest course. Most residents in the country are a part of his course, which is a proud achievement for me as a teacher when I see my own children growing. So, Siddharth, first of all, tell me, how did you think about this course? What was the turning point?
Thank you, sir. Thank you. Sir, we started the idea of this course looking into the resident courses available for the clinical section. Now, in the clinical side, we had resident courses launched for various specialties. But in the preclinical and paraclinical side, generally, we do not think of resident courses. So that was one thought which actually came after a discussion with you and the other educators who have actually started the resident course, that yes, we can do it. And that's the reason that this resident course started in a modular fashion rather than putting all the content at one place, so that we could give a sneak peek into the students that yes, this is possible and this is how they are going to take it forward.
Perfect. And how has been the response so far? Is it a very satisfying experience for you as a teacher?
Sir, the course is now exactly 1 year, 1 week, and probably a day old, if I say in the timeline. And sir, in this duration, I've already been able to get in all the three modules more than 500 students, and they are active students. So, sir, that gives me a chance actually to interact with students from every domain, right from the first year till the third year postgrad. Then I'm also having some senior residents and few consultants as well. So the highest what I have currently in my resident course is one of a senior consultant who is a associate professor at a government medical college. How a young community medicine postgraduate is being actually taught by this particular program. So that was a very big thing, that okay, there is someone who actually wants to learn the way we are taking it forward.
I think also, Dr. Siddharth, I wanted to know, like, for your course, like all the residents who are in their third year MD, who are about to appear for the exam, how should they use their course versus somebody who is starting their residency? How should they use your course?
Sir, the one who is going to give the exam, because this course is a live module. So generally, sir, we have weekly discussions on the schedule. So I actually asked the students that, okay, what are the topics you would like to teach me extra for probably this week? Because a third year PG might be under a lot of stress to get some particular answers. So that is where a third year PG gets a very big boost to understand, okay, suppose I want a topic on pedagogy. So he just drops a message that said, we can have a pedagogy topic. So I would teach them. So this is one part. Now, for a first year on the other, there is a planned schedule where I say, okay, in this module, we would be covering research methodology, which will run with 20 topics. So a first year student understands, okay, because I'm a newbie, I would be doing research, I will be doing a thesis. So research methodology course runs for the student. So this way, sir, both for a beginner and an end user, probably the one who is going to give the exam, this course is modifiable, because sir, this course is running as a live module rather than just a recorded version available for them.
So in the live module, do you also have that query solving, doubt solving with the residents? And do they also ask you doubts other than academics, like about the careers and about the life as a resident?
Sir, during the sessions, we have the emedicoz platform, which is a two-way interactive platform. So students are actually asking me doubts live when I'm actually teaching. So that gives me also a chance to explain a concept better probably. And they also are interested that, okay, the teacher took time out to actually tell us. Now, sir, apart from this, we are having separate sessions where we discuss on about what should be their career paths, where they should actually think. Because sir, community medicine per se as a branch, we always think that, okay, we will end up as a faculty. But it is not actually true. With the changing scenario, we see community medicine postgraduates coming up and doing different kinds of things, which generally is not there in the textbook. So that also goes up where we actually discuss on their career paths, about their challenge times. Because the biggest challenge, sir, if you ask me, is a community medicine being a hardcore doctor at a MBBS level turns into a engineer, because the first gadget which we should have is a laptop or an iPad, which generally we do not have as an MBBS. We generally have the Stetho as our gadget. So that's a difference which comes up once someone joins a PSM postgraduate.
And now you're not looking at a single person, you're looking at a community. So data and everything becomes more important as compared to a single individual, and that is where you have to transition from a single person doctor to a community doctor. So I
Exactly.
also want to know from you, Dr. Siddharth, that in this journey the resident also has a second year PG where they have to write a thesis also. Does your co and also they start getting more serious about the branch also in second year. Like for example, in my own time, second year MD was the time when I got more serious. That oh, boss padna bhi hai. So how was that journey? Do you help them in second year also?
Yes, sir. Sir, actually, second year is the transition year when we actually now understand what we have to do. Now, sir, at an MBBS level, our standard textbook is Spark, which is a single textbook for the entire community medicine knowledge. But, sir, as a postgraduate, each chapter of Spark is actually a separate book. So, in the first year, when a student enters the residency, he would only be bothered about, okay, I should put my thesis protocol, I should just understand what it is. So, it is second year when actually they start studying. Now, when they start studying, sir, for epidemiology itself, we have a textbook called as Leon Gordis. The book has itself 400 pages. Now, it becomes very much a challenge that a student second year may directly 400 pages he would be reading just for one chapter. So that way, sir, even my course caters that, okay, we have epidemiology module for 15 classes, which is around, sir, each class is like for an hour's duration. So it's like a 15 hours module for epidemiology. So they can just see that and they can refer Leon Gordis, because the base of epidemiology is Leon Gordis. So my resident course also builds on that standard textbook rather than just giving them, okay, this is what you should know. It's not that, because they would be doing that in second year. So that way, sir, it caters to them in a very big way.
So listening to you, it actually tells me that your course not only caters to, a basic level, it is actually kind of more level at which a resident is desired to be at. Do you think, any residents outside of India would also want to be a part of this course when they look at the epidemiology, or when they want to learn about the basic research methods, statistics? There are so many things that you are so good at. Do you think this course would become an international product also, or a part of it at least? Is that a vision?
Sir, already have students registered from Nepal.
Wow,
So that itself shows that students abroad would be requiring it.
so
Now, sir,
proud.
yeah, sir, it's a really a big achievement, because students abroad reaching to an Indian educator for a resident course is a big deal for us actually. So, sir, now if you look into the module, except for our health programs, which is specific for our country, the rest entire module is common. And sir, it is actually built up on the MPH curriculum, which is internationally used by even John Hopkins or people at London School of Tropical Medicine and Hygiene. So that MPH curriculum is same. So even a student sitting anywhere in the globe can actually be a part of this course. And rather, sir, if you see, globally the maximum research papers are being published from India, because India is a big country where the population size is big. So even if someone abroad wants to understand the health program in India and wants to work in a TB program, India becomes a good hunting ground as a researcher. So that's why they also need to do this course to understand the Indian health system. So that way it caters to them as well, sir.
And not only that, Dr. Siddharth, I was recently reading that now after MBPSM, we can actually do DM. There are a lot of DM opportunities also coming up in places like games. Can you enlighten the community medicine residents on that opportunity? And do you help them about that entrance exam to get into the senior residencies, to get into the super specialties? Because it is all sounding very exciting to me that, although, traditionally people would say that was community medicine mein jaake kya karenge. Now I feel it's a very buzzing branch to be in. So what are the opportunities and how do you help?
So interestingly, all the INICET institutes, including AIMS, CHIPMER, PGI, and even NIMANS, they have a community medicine branch. And so the entrances for this is just like our PG entrance, where we have a MCQ based exam of 60 marks, and 40 marks is a assessment by the concerned department. And same
Okay.
is for DM, sir. Even in DM, we have, sir, now opened up DM for the last 2 sessions on aviation medicine, on global public health. So
Okay.
these are also following the same pattern. Now, sir, interestingly, the question which comes up in this particular entrances would not be known to residents if they are not from AIMS and PGI, because they are like specific courses where only the teachers of AIMS PGI are working on a project, where they are working on some special statistical analysis. They are actually doing it. So because I have been through the journey through these institutes, being a AIMS Delhi postgraduate, then a senior resident from PGI, I got a chance to actually interact with my teachers. So I actually understand, okay, this is the topic, this is the project they would be doing. Plus, also, sir, they are asking core research questions. Like they are asking, okay, how will you do a meta-analysis? Now, for a postgraduate at PSM, doing a meta-analysis is like a rare exception. Probably 1 out of 1,000 would be actually doing a meta-analysis. But in INICET, both DM and SR, they're actually asking details. Okay, tell us how would you actually calculate the loss of heterogeneity? So that things actually won't be possible for a resident unless and until trained or learn together. So that definitely I am providing in the course, because being from those institutes, I would like to see my students would be placed there. So that gives a
So,
good feel.
so I'm sure your journey from the central institutes, both in your residency as well as in your senior residency, you've been a part of AIMS and PGI. I think that helps the residents even more to understand what is expected out of them when they are applying for these places. Beautifully put,
Exactly.
actually. And Dr. Siddharth, now if I put it in a nutshell, I feel that your course has different zones in it. There are some zones which are useful for the first year, and a lot of zones which are useful for the exam going residents. And in between, it gives a lot of mentorship to the residents, lot of knowledge, and all the standard textbook based knowledge that they would need anyhow. And they have someone guiding them through the books, which we never had at our own time. That is probably the vision behind DAMS also. That my vision is always to bring to the students which the kind of education which we dream of. This is the kind of education we want to deliver. So finally, I would ask you two questions. One is that what is, according to you, the forte of your course, which would make it different from any other such course?
Sir, first point is it's a live course. Second, it is not PPT based, sir. It is a proper digital classroom course where I write and I expect my students to write. It is delivered as per need of a student. It is not a one-way learning, sir, that where I want to teach, suppose this, I will teach that. It's not that. I actually take a poll from the student. Okay, what do you want that we should be running? Second, I am getting their, sir, MD question papers from universities. So every university will have a set of question papers. The last 5 years question papers I'm analyzing, and I'm putting it topic by topic for them. So it becomes easier for them to learn. And third, sir, a single educator course. This is very important for maintaining a quality standard. And sir, that's what we have learned in DAMS as well as a student, because I have been taught by you, and you are teaching our next generation, and they will teach the next generation. So there is a continuity. We are not actually breaking the relationship of a teacher and a student. And probably here we are looking as a teacher student and then probably a colleague. So that's where, sir, I understand that these students are not here just to learn from me. They're going to probably work with me in future projects as well, wherever I am working or any kind of projects I'm doing. So that way, sir, I'm very clear about that the course needs to have that kind of trust if we actually make a difference.
Awesome, Dr. Siddharth. Actually, I truly believe that you have created an international quality course, and I'm sure that the residents who are learning with you will, become a better Siddharth. I think that's a dream of a teacher, that you make your kids better than what you are. Like, I'm so proud that you when you call me teacher, it gives me goosebumps that okay, I have taught this guy. Now he's a mentor to so many more students, undergraduate, postgraduates. So I think that is the journey of a teacher. You touch many lives. So I'm very happy that you have taken this responsibility of running the resident course on the DAMS platform and for the PSM graduates, and you're mentoring them. And I am sure every graduate, every postgraduate one day will be on the platform learning from you. Any final message for the community medicine resident people who have recently taken up or will take up community medicine in future? When you take that decision, you're a little unsure. Am I right? Am I wrong? Any message for them when you look back now?
So if you ask me, community medicine is one branch which gives you a lot of chance to travel not only in India but world. But to have that enjoyment of travel, you should have good knowledge. Also, it gives a lot of impact, chance for you to impact the lives. So for that, you have to have a skill at a very early age. Jobs are very easily available, sir, in community medicine because you end up as a faculty in a medical college. But if you want to be a faculty plus, that plus is to become a researcher or someone who is speaking on international forums on depicting India, because you do not depict you as an individual, you depict your country. Because whenever, sir, we go abroad and we say, okay, prevalence of anemia or prevalence of TB in India is the
Yeah.
highest. But see, in
Yes.
last 10 years, the government has done to bring it down. You're actually speaking for your country, which makes you like more responsible and more of a nation representer rather than just an individual. That is what, sir, this branch gives you, but that needs a lot of skills. And so more of the thing is, it is MD. That means it's a subject where you have to read. It is not a MS subject. MS people read less, work more. MD, you have to read a lot. So community medicine does have a lot of things to read. And with digitalizing coming, sir, the biggest branch, if you ask me today, where digital has come up is community medicine. We are now even changed the Institute of Government of India, which was earlier a statistical institute. We have named it as Digital Institute now. That means the government also is looking into digitalization. So that's where probably those who have taken community medicine, it might not be a happy choice at first go, but for them, if they do this course and if they walk along, they should have that faith that they will do excellent. Because I am the biggest proof. I didn't take it with my choice, but I took it. And now probably I say probably that was the best decision I took, and I'm enjoying that. Probably I would not have done this what I have done after doing community medicine.
I think on that note, thank you, Dr. Siddharth, for joining in. And I want to inform the listeners that Dr. Siddharth has now a resident course for community medicine residents on the DAMS emedicoz platform. This course is available in different subscriptions of 1 year, 2 year, 3 years. And it is even useful if you're just joining or you are an exam going resident. It is, in my vision and in Dr. Siddharth's vision, it is meant to be a companion for life. Because in a branch like community medicine, you have to be updated. Probably not yearly, even more rapidly, maybe monthly, at the pace with the government is going. And when you hear the word digital everywhere, it is running very fast. So that is our vision, to be your education partner for life. And I'm glad that Dr. Siddharth has taken this endeavor for community medicine residents. Any questions you have for him, please put in the comment sections. Please let us know if we can help you further. Dr. Siddharth and I we are dedicated to making medical education easier for all of you. Wish you all the best. Thank you for joining in.
Thanks.